Good afternoon. I'm Dr. Jaime Estrada. I'm the president and board chair of Texas Doctors for Social Responsibility. On behalf of our board of directors, I want to welcome you to our November Public Health Launch Conversation. This time, we're honored to have as guest speakers State Senator Jose Menendez and Kate Murphy, Senior Welfare Policy Advocate at Texans Care for Children. Senator Menendez and Kate will talk about why it is urgent to reform our foster care system and how they propose it could be done so that it becomes an integrated, efficient, and most of all, a humane safety net for our most vulnerable children and teens in the state's child protective system. Senator Menendez represents District 26 in the Texas Senate. Since elected as a state legislator in 2015, Senator Menendez has passed into law over 400 bills benefiting children, seniors, veterans, and Texas families. He is also a strong advocate for job growth, community, and business development. Senator Menendez currently serves as chairman of the Texas Senate Hispanic Caucus. Senator Menendez leads the Blue Ribbon Task Force, an advocacy organization that works to advance community-based solutions to prevent child abuse and neglect. Senator Menendez outlined potential solutions to several of the main problems that affect our foster care system on a recent op-ed entitled, "Texas Should Use Federal Funds to Boost Foster Care," published in the San Antonio Express News on October the 8th. Kate graduated magna cum laude from Austin College with a BA in Economics and Political Science. She earned her law degree from Texas Tech University School of Law, where she was inducted into the National Order of Barristers for her achievements in oral advocacy and received awards for her accomplishments in constitutional law and property law. Since joining Texans Care for Children in 2016, Kate has played a leading role in proposing and passing legislation to improve support for pregnant and parenting youth in foster care, among other legislative victories. Kate serves on the Texas Supreme Court's Children's Commission Collaborative Council and the steering committee of the Texas Child Protection Roundtable. She's regularly invited to serve on work groups that shape internal policies at the Department of Family and Protective Services. Kate is also a member of the Child Protection Section of the State Bar of Texas. Kate has written extensively about substance use disorders in families and the failings of our foster care system, particularly to teen girls. Her most recent comprehensive analysis of the foster care crisis, entitled "Responding to Texas' Perpetual Foster Care Crisis," is available at the Texans Care for Children website. Thank you, Senator and Kate, for accepting our invitation. To the attendees, please send your questions via the text box. If there's time, we will ask our speakers to address oral questions and comments also. Without further ado, Senator Menendez, Kate, who wants to start first?
Why don't we let Kate start? Ladies first.
All right.
Well, I was going to defer to you, so but I'm happy to get the ball rolling. I'm Kate Murphy with Texans Care for Children. Thank you for having me here today to talk about this. We're very excited to be here and happy to answer any questions that y'all have. So I think, the thing that's top of mind with our foster care system and what has been all over the news is the capacity crisis. The foster care capacity crisis is what a lot of people are calling it. And what that really means is that we don't have enough homes and safe placements for some of the kids in our foster care system. And when you break that down, what it really means is that we're struggling to find safe and appropriate placements for older kids and kids with complex needs. And instead of placing kids in a foster home or a really specialized placement that can meet those needs, we have kids sleeping in offices, we have them being shipped out of state, we have them in unsafe institutions that are being shut down, and even some of the solutions that DFPS has been working on, like temporary emergency placements present some challenges. For example, we heard about at least one kiddo up in the Panhandle area, and I don't know how widespread this is, but there's one kiddo up in the Panhandle area who has been in 16 temporary emergency placements since January of this year, which is pretty mind-blowing. So she technically hasn't been without placement, but she's been moving around a lot, and that is not great for her. And so we're trying to figure out and drill down on what we can do to really make this better. Because one of the things that we know it's a disproportionately high number of kids who are without placement in foster care who came into care for reasons related to behavioral health concerns. So one of the reasons that they came into foster care in the first place is because their parents were unable to get access to services or support or what they needed to help their child with known behavioral health challenges. And then they entered foster care and were still unable to meet those needs. That accounts for about 35% of our kids without placement, even though it's only 5 to 7% of kids in foster care generally. We also know that a lot of the kiddos are older, and from the federal lawsuit, the data suggests that most of the kids who are without placement came into care at a basic level. So we label our kids' level of need as basic, moderate, specialized, intense plus. So most kids came in without complex needs, and due to instability or continued trauma or their other experiences in foster care, their needs escalated to a point where they are having more acute behavioral health challenges. And so we're really trying to figure out what we can do, one, to support kids and prevent them from entering foster care at all, and keeping them at home, keeping them in their community, getting families that support that they need so they can really thrive. Or if they do need to come into foster care, making sure that we have the care that we need within the system available to those kids in the system so they don't escalate to this crisis point where it becomes really challenging to find a provider that's able to meet their needs or willing to accept them even. We also know that this isn't a new problem. You can look at headlines dating back to 2016, even earlier than that, that talk about the shortage of homes for kids with complex needs and older youth, which is where we're still seeing the most significant challenges. We've seen this reflected every year in the foster care needs assessment. And so this is not a new problem, right? It's intensified this year. That's been driven some by COVID. That's been driven some by what's going on in the lawsuit. And I think I want to make a note to be very careful in how we talk about what is going on with the foster care lawsuit. If you're unfamiliar, the state was sued about 10 years ago, and a judge found that there was an unconstitutional risk of harm that kids in our foster care system face that we need to figure out. And so one of the things that has happened in the last few years is we have court monitors who are paying attention to different aspects of the system to make sure that we're fixing those problems that we're keeping kids unsafe. And what we've seen is that DFPS is going out and investigating to see if there's been abuse or neglect in these homes, and licensing is going out to see if there have been safety issues that violate our minimum standards. And we have enough of those that are of a higher level, so that are rated as high risk, medium high risk, or is a confirmed allegation of abuse or neglect, or obviously higher, very high risk. And if they have enough of those, they go on what's called heightened monitoring, where they're supposed to get extra support and a little extra attention to make sure that they can resolve those safety concerns. And if they can't, one of the things that might happen is that they will close. So we know that we've lost over 1,000 beds, mostly in larger facilities, in part related to funding issues that came up because of COVID, and in part because of serious safety concerns. I think that there have been some questions bandied about how serious these safety concerns are, but I want to be very clear that what came out in the last hearing for the lawsuit is that DFPS has gone back and reviewed these, the monitors have reviewed these, HHSC has reviewed these, and none of them said that they were things that were not serious concerns. And so I think there is room to figure out how we do a better job of supporting providers and how we get them to a higher level of quality so these concerns aren't coming up. But we're not talking about silly things. And I think that that has been a little bit of a misconception that has floated around what's happening with the lawsuit. And so our focus at Texans Care for Children, because this is longstanding, because we know that these are real safety concerns, and because we know that we need to do a better job for our older youth and for our youth with high needs, we're trying to figure out what it really looks like to look further upstream, to really try to see how we can expand our mental health services for kids in care, how we can do a better job of keeping kids out of care. We know one of the #1 reasons that children enter the foster care system is that they are very young and their parents have a substance use disorder. That is a main driver of kids into the foster care system, but it's really pinpointing what is leading to that foster care involvement and figuring out how to do a better job of supporting our families. And then that has a trickle-down effect, because I think people think of CPS as a service provider. They're not really a service provider, they're a service connector. And so if there aren't services to support the child and the family outside of the system, CPS doesn't have like new magic services available once the kid is in foster care. They're relying on the same network of services and supports to wrap around that child and family, either to try to reunify them or to support the child in another setting. And so what we really think is the key here is to focus on those things like, how do we support our young kids in Texas who are at higher risk because they're so vulnerable? How do we do a better job of supporting our kids with more complex needs? How do we support our caregivers with complex needs who maybe are struggling with substance use disorders, who are maybe a pregnant and parenting youth themselves? How do we address family poverty through things like Medicaid expansion, childcare subsidies, things that we know might contribute to a neglectful supervision situation? How do we address family violence? How do we help with housing instability, food insecurity? These are the kind of large, system-wide, statewide challenges that are really leading to families just winding up in this crisis point. And CPS has to take them, right? CPS is the system where kids wind up when all the other systems have failed. And then they're also continuing to rely on those systems that have already failed kids and families. So that has been a strong focus of our work at Texans Care for Children is, one, how do we keep those kids out of foster care? And then when they're in there, how do we provide better support for those kids and families so that they don't continue to get worse once they're in the foster care system, so that their lives actually do get better? Because if their life isn't going to get better, we shouldn't be getting involved. And so that might look like more respite care options. That might look like family partners. That might look like parenting better with biological parents. There are so many things that we can talk about and try to figure out. De-escalation things. Transition services are a big piece. We have a lot of kids who go into residential care because they have behavioral health concerns. And then we don't do a very good job of transitioning them back home and back into their community. And that has been a major gap in the Texas system for a long time. That is a key focus for us. How we do that well, how we prevent kids from just staying stuck in residential facilities or cycling through a series of residential facilities. So I think that's an overview of what our focus has been and where it will continue to be as we move into the next year and next session. And with that, I will turn it over to the Senator.
Thank you, Kate. We have already a question on the chat, but I'll let the Senator address this after his talk.
Yeah, so thank you, Doctor. I want to thank Kate for her very in-depth analysis. I think folks, like many of the concerns that y'all see on a daily basis when you're seeing families, a lot of the exacerbation of the problems of our system, the root cause, in my opinion, has to do with poverty and a lot of the problems that come out of poverty. First of all, let me say good afternoon to everybody and thank you for being here to discuss this very important issue facing our state. I don't have to tell you that the pandemic has had a devastating effect on our community, in particular our foster care system, but the community at large. You know, the state, as Kate mentioned, has lost over 1,000 foster care beds over the last year. And the number of children without placement has increased every single month since the beginning of 2021. This is a crisis that we have seen in this state over the last decade, and it needs the legislature's full attention for quite some time. It's not going to be a one and done situation. We're not going to just come in with a magic wand and fix it. During the second special called session of the 87th legislative session, we added funding to address the foster care capacity crisis. And while this was a step in the right direction, we are hopeful that the increased reimbursement rates will lead to more placement options coming online soon. But we still have to address so many of the other issues within the problem, the root causes. And that's why we decided to publish or to present to the Express News the op-ed that was published and to provide information on things that we can do to improve the system statewide. At the end of the day, we need to focus on the children. The children that we currently have in care, and hopefully the diminishing number that we should have in the future, because I don't unfortunately think we're ever going to not have children in the system. We need to be working to provide them the best resources and the best services available. In the third called special session, the governor put on the appropriation of $16 billion in the American Rescue Plan Act funds, the federal funds that Congress and the presidency, the White House, sent to our communities to provide much needed relief for COVID that have been struggling. It has been mentioned that these funds would be needed to be used for one-time expenses. And I had some amendments that I proposed to the bill author, Senator Nelson, because I had been working with stakeholders from all over the state to find out specific problems within the system that have been exacerbated by the pandemic and that would thus qualify for the funding. The first amendment we proposed was to fund the implementation of a new, completely integrated, interoperable data system for the Department of Family and Protective Services. In order for the state to adequately protect and support children, we need to offer stakeholders access to real-time data that will assist with the coordination of care across their health, education, social services, and specialty care systems. There is absolutely no excuse for a state as large and as wealthy as ours involved in a child's case to be clueless where some of these children are. Their whereabouts unknown, completely unknown. A child in foster care is a child that means is the ward of the state and is our responsibility. And if we had this type of system, it is my opinion that we would be able to better provide wraparound services in a quicker time frame, thus getting them, if they needed physical health care, mental health care, social emotional health care, we could provide that in a faster time frame. The next amendment that we presented was to provide additional financial support and resources for those who are kinship caregivers. And as has been mentioned many times, parents are out of the picture because they have an issue with either drug or alcohol dependency or run-ins with the criminal justice system. And, you know, at that time, there are many times where in the middle of the night, a grandparent, an aunt, an uncle, even an older sibling gets a call and says, look, we understand you are related to these children, and either they go with you or they go into the foster care system. The proof is in the pudding. The proof is undeniable. The children that stay within a family unit do better. They have better outcomes than going into the foster care system. Many of us on this Zoom probably already know grandparents, aunts, uncles, or siblings who have stepped up to take care of a child in their family. And while we've been able to get them a little more assistance from the temporary assistance for needy families payments through a bill we worked on with Representative Minhada, Senate Bill 263, they still are receiving minimal financial assistance from the state, nowhere near what the foster care people are getting. And to me, it doesn't make sense that if we know that a kinship relationship or placement has better outcome, that we wouldn't get closer to supporting them. In order to encourage and support these placements, we need to provide the needed levels of funding for training. I think particularly for family members who are providing care that have specialized services and specialized needs. We already know how expensive and how difficult it is to come across mental health care services. The third amendment we offered was to use ARPA funds to provide bonuses for the child serving staff and the child welfare system. These professionals have been on the front lines of this pandemic and have experienced significant stress over the last year and a half. The turnover rate in the profession is fairly high, and the funding could have been used to provide bonuses to recognize their efforts. Many of you may or may not know this, but we've had state employees sent to an urgent care facility or a hospital because they've been punched in the face, because their hair has been pulled out. They, in many cases, are on a one-on-one situation. They're asked to be watching children 24 hours. It's almost impossible task. And as Kate mentioned, where we have people who due to the lawsuit and due to the judge's request, even though they should probably have been aged out, they're still under the care of the state. She won't let them out. Finally, we've offered an amendment that would have restored the funding for the purchased client services, otherwise known as PCS, that was recently cut in the state's budget. PCS supports children in several stages of service, including reducing the length of stay in foster care and substance abuse prevention and treatment. Unfortunately, we could not prevail on any of the amendments that we offered, but it was accepted, and we were ensured by leadership that we would have all four of the amendments entered into as interim charges to study the benefits of these things. Addressing these issues would not have made the system perfect, but it would have gone a long ways towards helping make things better. And this is why I say we still have lots of work to do to tackle the root causes of child abuse and neglect, but I know that this would have been a good opportunity to make significant improvements. You can count on me in my office to continue to fight for children who are in care, and looking forward for ways to work on this issue more during the interim. Yesterday, we had a great meeting with a lot of people in the field that work on these issues. And I said, like I said, before the session ended, the special session, I got a commitment that the 4 items that I presented as amendments would be studied as interim charges. I think that we have to find ways to prove the case why we need to make these things happen. And so I want to thank Dr. Estrada, who, after the op-ed came out, called me, reached out and said, hey, we'd like to talk about this and see what we can do. I am confident that many of you have seen children in your practices who probably have suffered due to the injustice, social inequities, and economic injustices that suffer at home. Probably every one of them completely out of their control, and something that we could do a better job as a state. If we want to brag about what an incredible state and economic miracle, we should not leave people out of that. We should not just, it shouldn't just be a miracle for the big Fortune 500 companies. It should also be something that we include everyday working families and their children. And so thank you. At this time, I'll be happy to try to address any questions, comments, or remarks.
Thank you, Senator. Well, we'll have, we already have a couple of questions in the chat box. Dr. Chintapali put in the first question, which I'll read. It's directed to you, Senator. She says, I took care of kids with trauma and multiple foster cares when they are already fragile with 100% disrupted early relations, 0 to 5 years when they hardwire for survival or thrive. Changing foster homes multiple times can adversely affect them and create a volcano. I think she meant the effect that can make families explode or withdraw and commit suicide. I feel that if government really wants to stabilize kids and families through path of love and security, to rewire them and make them resilient, build a government monitor residential schools, 0 to 19 years, where kids get schooling, feel love and safety, get teachers trained in integrating human values into core knowledge subjects, get trauma focus, cognitive behavior management, get medicines and bring families by force to come and work with them to build the resilience and make them get over intergenerational trauma. She also adds, I also know that foster kids are taken to make money, but they do it to get love and nurture, which is what they need. If you work with character-based residential school, I will definitely help in actually setting up a healing program. If I may, Dr. Tabali has a lot of experience in working with kids who have been traumatized, and she actually has been working on a program to help them and their families. So, Senator, do you want to address this?
Let me
question?
unmute here. Yeah. I think that as I read in the chat, Dr. Chibatali.
Chintapali.
Chintapali,
I'm online.
hello,
And
Yes.
I can say something. So they're so fragile because the relationships got disturbed because of the intergenerational trauma. When before they were born, to the relationships breaking, drugs, alcohol, substance use disorder. And this has been escalating and escalating unless somebody stops it through education. And parents withdraw themselves. This morning, a telemedicine call, I spent 36 minutes from a mother who has got 5 kids who are all exposed to trauma. She had 2 relationships, incarcerated husband. And then when they go to a foster care, they go to a children's shelter and then they're in a foster placement. They do not have the same kind of a patience where there is a protocol that is followed, they're another $250 a month. And I'm sorry, I'm very honest about it. I've seen many families exploit this foster care situation also, the love and nurture. Very few families have been good Christians who feel the Christ consciousness and give it. I think the solution is, instead of wasting money on these foster cares, there should be some residential places, 4 or 5 established in Texas, where the kids are driven over there and the parents are forced to come and get the education. How they become what they became, because it is related definitely to 3 to 5-year-old child trauma. And if the kids get this safety that I'm safe here, I'm secure here, even the medication dosage can be cut down because they're in a very well-placed situation. Senator, I think, this has crossed my mind several times. Every single time I see a traumatized family and the children went from one foster home to the other, to eating stools, eating worms, that's what they came from. They don't need that. And instead of being in one children's shelter and go to a foster care, and then they couldn't handle because these kids are sensitized, they reassure themselves by acting up so they can secrete their own paregorics that make them feel comfortable. And so they're very difficult to deal with unless every parent is specially trained. So Senator, this is a big project. I can come and show you the PowerPoints also. I can come to your office.
Doctor, I look forward to meeting with you. I understand and agree completely that that this problem is huge, and I do not disagree with you that there are people who are taking advantage of the system, and every system that we have has been taken advantage of. I will tell you too that it might be a huge hill to climb to, in essence, and I guess I'd have to figure out what you're saying is an institutional environment for kids 0 to 19. It almost, for a lack of a better imagery or analogy, it reminds me just in the mentally of what would be considered or thought of as an orphanage. But I don't think that's what you're thinking. I think we have to find a way to get to what your goal is without the institutional setting. I don't think that the institutional setting, based on my experience in the legislature, that would go very far. But I look forward to working with you and looking for ways. I agree with you that these issues are not all of a sudden overnight. These are multi-generational. But also they have to stem with a lack of education. They stem from a lack of an ability to control your own destiny in terms of food insecurity, in terms of transportation, in terms of so many of the issues that revolve around whether a family feels that they have a future. And when you have no hope and no feeling that you're going to be able to get out of this trapped institutional poverty, then many times you just don't care what the outcomes are. And that's where I think sometimes the dependency on alcohol and drugs takes over, and the lack of investment in themselves and possibly in their families. And it's not, in almost every case, it's not the family's fault that the system's been set up in a way where they've been gerrymandered, or their schools and their neighborhoods have traditionally had the smallest investment by the state who funds these schools, and therefore not able to hire the best teachers and not able to have the best books, and so this is a institutional discrimination. And so therefore the investment has got to be a much larger investment on behalf of our whole community, the city, the state, the county, and the federal government. But you're right about one thing, that it has to be done in a smarter way. And we have to, in order to get to the root causes, we can't just be trying to slap Band-Aids on symptoms. And I think that's what we've done for too long, which addresses the issue that someone else brought in Mr. Fox brought in the comments. The state of Texas is currently being sued because the judge has declared that kids come out of our foster care system more broken and worse than they've gone into it. And so I completely agree with what you said, but I just don't, I know what your goals are and I agree with those. I just don't think that we're going to get there in the setting that you described.
Kate,
Senator,
would you like to weigh in?
Yeah,
hold on, Dr. Dean. Kate, do you want to weigh in on this?
Yeah, I think I'll just add a little bit to what the senator said, because he did a really good job of covering it. But I think one of the challenges when we're talking about residential settings is that most of the research does not support good outcomes for kids who grow up in more large-scale institutional settings. The research supports that we need to take care of kids, first of all, in their own family, if possible, and then if not, in a well-trained, well-supported other family setting. Most of the research suggests that kids who grow up or who have extended stays in residential care do not do well. So it's not just based on experience, it's also supported by research. And I think another piece of that is that the federal government is no longer funding larger, more institutional settings because of that challenge, unless they meet some very, very strict requirements that are intended to enhance quality. And Texas doesn't have any providers right now that meet all of those requirements. Actually, it's something they're working on doing. It's something that they're testing a lot of things around, but we really, both from a financial perspective and also from what the research shows, I think there's a strong movement away from more congregate care types of settings toward family-based settings that are well supported and well trained. So I agree with the senator that there are ways to get at those goals. I think thinking through ways to really support parents and take care of parents is a key piece of it. And I just also wanted to add that I think what you said about needing to support kids through education and social emotional learning and trauma-informed care, those are all things that there is a strong movement to build that into our school systems generally, so that we're training teachers on trauma, we're training teachers on social emotional learning, and we're training them in how to work with parents on those things. So I think that there are ways to, just as the senator said, ways to get at that are maybe not through that residential school, that I think would be not necessarily consistent with what a lot of the research suggests as best practice, and also that would be easier to find financial support for.
Yeah.
If I could piggyback, piggyback on what the senator
Mina,
said.
please wait. Let's go ahead. Let's move on. Dr. Dean.
Okay. I'll put it in the chat.
Thank you. I'm a retired pediatric lung specialist from 5 years ago. So the social determinants of health have really come to the forefront in medicine as an underlying cause of a lot of chronic problems, chronic health problems, and lead to a dysfunctional, somewhat chaotic family. And so, Ms. Murphy, maybe you can clarify this upstream. And I think root causes have come up a lot, but what there appears to be a substantial number of resources to help families deal with social determinants of health in the community. Yet there appears to be a lack of coordination and assistance for the families. My training in Florida, there initially, when there was identified some problems, there was a social worker would go to the home, try to identify problems and try to navigate the family through the resources available in the community. Is that available, at least in the Bexar County area? Are you familiar with these interventions that can try to deal with the root causes so the whole family benefits from these interventions rather than the child taken from the home? Thank you.
Who wants to take that? Kate?
Yeah, I can take a first whack. So yeah, yes, but not enough would be my quick answer to that question. I think there's broad recognition that there is a need for better coordination, and there are a few things that we have that try to do that. One of those things is what's called a CRCG, and I'm gonna butcher it, but it's a community resource something. Community resource something, CRCG. You can look it up. They're usually affiliated with the local mental health authority, or they coordinate closely with the local mental health authority. And within that model, you can have a caseworker who helps you navigate and find community-based services. Those are available statewide, but they're a little bit limited in what they can do and how effective they are, and they're a little bit constrained by what's available. Bexar County is a very resource-rich county, so there probably is more for them to work with and help with in Bexar County than there is in some of the more rural parts of the state. So that's one thing. And then I think another thing that is still evolving, and we're still kind of learning how it's going to work and what it's going to wind up being like, is community-based care, which obviously has been present in Bexar County, but isn't right now because the contractor is pulling out because there were so many challenges with it. But one of the goals with community-based care is to have more robust community engagement, a more community-driven process, and some better ways of wrapping around kids and families. So I think that's where we're headed, but we're not quite where we need to be on that, if that answers your question. And if the senator has something to add, I'm happy to pass the mic.
Yeah, thank you, Kate. Dr. Dean, I'm sorry, just so that I make sure I understood your question correctly, could you restate it for me?
Certainly, it's challenging for a physician to determine when a family, you can't work with a family any longer because they just can't seem to in my case, manage the asthma correctly, and the child keeps going to the emergency room and puts them at risk of death, yet just consulting CPS, and maybe I haven't utilized the full extent of my responsibility towards the family, trying to search out these social determinants. But could there, in Florida, a social worker goes into the home and helps them navigate the resources available in the community. Yep. I think physicians really have a hard time referring families. They can identify these problems, but it's such a complex referral basis, and you have to rely on a family that is not functioning properly to navigate the challenges available to them, even though there's many resources available in Bexar County. And it would be ideal if there was a one source place with navigators that could run the family through all the resources and try to intervene before the child becomes a victim of this situation. And I'm curious, does that exist? Are people aware of that in at least in Bexar County? I don't know what can be done at the state level. I'm a little bit disappointed at the last legislative session of what they put on their priorities. But what can be done locally? Like,
Joy, you're not alone in being disappointed in what the quote priorities of the legislature or the leadership of the legislature have been recently. So, but I won't go down that rabbit trail. We'll be here for a while to more specifically address your concerns, comments, and issues. Is that I can imagine how difficult it would be for a medical professional in a very short amount of time when you're focused on a clinical visit where you're trying to address a health issue, to be asking or thinking about, well, what are the outside circumstances that are going to keep this child from getting the medical care that they need? Some of the health providers in our community have come to the realization that they have to have very intense follow up with the families and the patients. And what I've noticed, unfortunately, due to my personal family's interactions with the university hospital, they've done a good job before they discharge you to try to set up all your follow-up appointments. And then people call, and then people try to ask you if you understand. They actually bring someone in to talk to you about, do you understand what the how to do the follow-up with the medicine and all of these things. They understand that you may just come right back around if you don't, take care of the part that you're responsible for at home. And so I think there are some medical providers, some organizations that have understood that it's in their best interest. I can tell you, when you use the word navigators, it reminded me of something that a friend is in the process of building for the disabled community. And Gordon Hartman's creating a sort of a one-stop for kids with disabilities, where they can show up and they'll have navigators walk them through the process, and try to have every state agency there and have everything that they would need in one place. Because as you can imagine, if you already are a family where maybe you're relying on one car or public transportation, and you're telling them that they have to go to 3 or 4 different places to get access to the medications that they need, or the therapies that they need, or whatever it is, it may be physically impossible for them to comply. And sometimes throw in some frustration, throw in some life issues, throw in some cost of gas issues, so many other things, that it would be very difficult. So part of what I think the state needs to do is figure out ways to partner with the healthcare providers, not to try to interfere with those of you in your private practices, but find ways to give you an easy way to provide a non-threatening way to interact with the state. Because the problem is, for both the medical provider and the family, is that the majority of the time, Child Protective Services is seen as an adversary, or seen as potentially the agency that's going to strip you of your children or your right to your children. And who wants to dissolve families when you know that you want to keep them? All you want to do is provide them some help on how to take care of their children. And I think we've got to do a better job, because we know for a fact our foster care system's not helping the children. So then we need to be finding ways to provide wraparound services to the families at the point that they need them before it becomes a big issue. And that comes in the terms of the education. It comes in terms of, I've been reading a lot of these community resources, coordinating of groups, all these things. Everyone that's putting in the chat, you're not wrong in how we can interact and better interact. We need your ideas as practitioners, as people in the trenches. You're gonna help Kate and I provide. Kate, fortunately, she's going to be providing recommendations to all the legislative offices and into leadership. And so that's why we wanted Kate to be on this call. And we're just one of the many offices that just has a passion to try to help improve the system. And so thank you for your question, your remark. I'm not sure that I fully addressed it, but I think that's all I have at this time that I can better add to your concern, Dr. Dean.
Great, thank you, Dr. Dean and Senator. Let's move on to the next question. I think on the queue is Dr. Garza. Dr. Garza, do you want to unmute yourself?
Yes, so I'm glad you could start. I only have 2 minutes. I have to go work right now. But I know, Senator, I spoke with you in the past on I think it was one day about 2 children in foster care. My frustration as a pediatrician. And I find looking at these families, getting to know them better and going the extra mile you may have all those social services available, but if you can keep the nuclear unit of the family together, it makes the biggest difference. Transportation is a huge problem. A Medicaid family cannot take the other children in the transportation van to go to the pediatric visit for the newborn. How can the mom leave a child with nobody? So she does not make her appointments. A lot of this leads to the next steps of issues having parental care. So I work at a pediatric office that offers urgent care. And many times families, they hop to all the places for care because they're desperate. So you have fragmented care, and pediatricians need to be rewarded for the work they're doing. And the staff, we get paid very little. We're the private practice pediatricians do not get the extra funding the government gives to University System Children's Hospital. And so many dedicated pediatricians do not take foster care kids. The other frustration is the Medicaid, they're only available to have a superior, and they deny almost every therapy that we request. So if a kid needs occupational therapy, speech therapy at a very young age, these children become more complicated, and then they end out in the foster care system because they were neglected from the very beginning. I would love to have a Medicare Advantage program for children like they have for senior citizens. How can you prevent diabetes in a 65-year-old when you already had it when you're 10? So I think the funding for these things are in the wrong places, and we are paying astronomical costs and destroying so many children's lives. So unless you're really seeing people in the forefront, hardworking families for 20 years, they get in a homeless shelter, they go get a house, the house has mold, then they go move into a hotel, and all the social support systems that they are in there are so complex. I help so many people on the outside, and because I do part-time work, I have that luxury, but other pediatricians can't do that in their 60-hour week. So please think of us as partners. You don't ever mention the pediatrician in any of your conversations, but we are a very big part of them from the moment they're born. Gotta go, bye.
Thank you, Dr. Garza. Who wants to tackle that?
I just want Dr. Garza's contact information. I know she said we've spoken, and I know that,
Okay.
but I think it's important. What Dr. Garza said, and that was a perfect example. Her conversation about transportation and the mother not being able to take all the children in the transportation that's provided for is a perfect example of the government not understanding the little neat box that you're creating, how it doesn't work for families every day. Mm-hmm. and how it just keeps people from doing what they need to do. And so that's a perfect example. So we do need more input from the pediatricians and input from the family practice doctors who are seeing these patients to tell us, well, this is where it's failing. This is where the system's not working. And this is, and that's a perfect example. That was a great comment.
Yeah, I was just gonna say, Dr. Garza was speaking my language with that comment. She really seems to have a deep understanding of some of the complexities in sorting this out. One of the things that came to mind for me when she was talking about transportation and where do you put the kids, and where do we spend our money? Where do we invest our money? And are we investing it in the right places, in the right ways? I think the answer to that is no. In a lot of circumstances, no. And I think one of the most striking examples is how much money we allocate to protective daycare in child welfare. So for families where there has been a CPS investigation and we offer family preservation services, the single largest part of the CPS budget is for childcare for families that are part of our family preservation or family-based safety services system. And I think that need doesn't go away when CPS is no longer involved in their lives, and it existed before they became involved with CPS. So should we be investing that money in childcare subsidies for a broader group of people? Probably, right? And that's just one of many examples we could go into about that. So I really appreciated her comments.
Thank you, Kate. Senator and Kate, I can give you Dr. Garza's, I'll send you Dr. Garza's contact information. Patrick, Dr. Herndon, do you want to ask your question, please?
Yeah, sure.
Or comment?
Let me tell you, just to try to breeze over a little bit of my background with, organizations like Casey Foundation, Hogg Foundation, Moody, all of these foundations, and having put on conferences and gone to that, done the probate law on disability and I see that one of Senator Zaffarini's staffers is here on the broadcast now, and I've been doing this for at least 3 decades, including in the legislature itself. And what you've described here from an institutional and public point of view is a system populated by silos that don't communicate with each other very well. And we spent so much time at MHMR and other different institutions, Child Protective Service, DFPS, and so on and so forth, trying to get them to coordinate and talk with each other, which of course is opposed by the force of the budget that goes to that particular institution. But the question I want to ask in that context of all those difficulties for public institutions and funding, and as well as getting personnel to actually implement this stuff and make it possible, is basically that's several areas. How does all of this apply to immigrant children? How does this apply to rural areas where the institutions to do this are not even there? I remember volunteering time in Alpine, Texas, which is in the middle of 5 counties that are bigger than states in New England. And they had 1 medical social worker for those 5 counties. 1 medical social worker for 5 counties. Were basically owned by Clay Desta, unfortunately. So how do we address the area? How do we address poverty when there's no institutions there to work with in rural areas, and particularly in impoverished areas, in urban areas? How do we deal with that? How do we deal with disabled kids in this? And there's just areas that are deserts. I mean, the impoverished areas, the inner city areas are just like the rural areas. The institutions and the structures are not there. And how do we get integrated and coordinated activity by public institutions, the funds, the personnel, to actually address these areas where there haven't been any institutions to do that?
Yeah. Senator Kate?
There's no medical care there. You know, that the educational resources are not there. That's the reason a lot of these small towns and rural areas end up becoming ghost towns.
Right. Thank you, Pat. Who wants to take the first shot at that?
Well, what Patrick described is a sad reality of a very diverse state, a state that, you know, how do you compare Alpine? How do you devise a system that works for Alpine as well as it does for Dallas or Houston or San Antonio? The needs are very different. And, you know, we've been for years trying to figure out ways how to even get doctors to rural parts of Texas. So we have huge challenges, and I appreciate Patrick's his involvement for many decades in trying to make things better. This is probably part of why we still have the problem that we have, because of the silos that he mentioned. That's a big problem. I brought up that issue yesterday, that we have too many state agencies and providers and everybody working in their own independent silos. We're open and looking for ways to make a difference, to make things better. But, you know, it has been, I share the frustration that I heard in his voice, because just the way he's been toiling away for so long, just recently, common sense measures like these amendments that I presented that would have been easily to fund, that not able to get the leadership support on those things, can add to that frustration. So we just have to keep speaking the truth and keep highlighting the need and finding ways to get more people to buy in. We just need to grow the number of the coalition, the people that are interested in making things better, and not give up. Because if we give up, then everybody loses. And like you mentioned, the ghost towns, and people are left behind. And you know, we just can't leave people behind. We have to do what we can and do the best we can. So I don't have a lot other to offer than that. I don't know about you, Kate.
The only other thing I have to offer is just to validate what you said, and to I guess one thing that I am working on in that regard is we are trying to plan a project at Texans Care for Children for next year, where we will bring together a new coalition with stakeholders that are more cross system. So bringing in people from the adult criminal justice system, from the juvenile justice system, who work on immigration issues, who are part of rural communities, and having a new advisory council where we're really trying to break down those silos, because we've been talking about it for years, trying to get it to happen, you know, maybe at a more state level setting. And so we're just going to try to do it ourselves. And so I've been working on planning a project around that, and charting that out. And we'll be looking for funding to try to make that happen over the next year, so we can see how we can contribute to that conversation, since it has been a perpetual struggle to make it happen at the state level, and to get support for it from the broad legislature. There are people who support the idea, but getting it to happen on a real broad scale just hasn't. So I'm going to try to do it with the help of other people who have expertise in some of the areas where I lack, because the child welfare stakeholders definitely recognize the need for that, but don't necessarily have the expertise in all of those areas to really make the difference we need to make. So we're going to try to bring together some of those voices in a more meaningful way than has happened historically.
So,
Thank
yeah,
you.
and it's, and just as a closing comment, you've mentioned the justice system. which in a privatized prison system is the ultimate beneficiary of all of this. They get the contracts and they get the money to take care of and house people that get abused in this system. And speaking of pediatrics and medicine, there is a movement now finally catching on that some people, in fact, I've been hawking for 20 or 30 years. It's called AYA, Adolescent and Young Adults Care, with that transition from being a child, you know, is spread out until you're 24, 26 years of age. It doesn't happen when you're 18. It doesn't at midnight on your 18th birthday.
Yeah.
So
thank you.
has a place in this as well.
Yeah. Thank you, Patrick, for your comments. I like to be respectful of everybody's time, and I know there is lots of comments and questions, and sorry to keep you holding, Ted, but I think we're gonna close now, and I would like to thank Kate and Senator Menendez for your participation in our public health launch conversation, which I found very interesting and informative. And you know, I think this is just an introduction. I think, as the Senator and Kate says, we need to keep fighting. We need to keep raising awareness of the issue, and hopefully we'd like to have you guys over again pretty soon. And thank you all. Thank you all for tuning in.
Thank you very much. Have a good day.
Thank you, guys.